Welcome to another episode of Between Two Servers. Between Two Servers is the podcast that doesn't actually take place between two servers, but talks about everything that exists between two servers. This episode we have a special guest, Rosa Hoffman, founder and CEO of Medscures, a technology company dedicated to making medicine secure. Their mission is to change the way the world uses medication. We're incredibly excited to welcome Rosa to Between Two Servers, and Sonia will be speaking to her about women in tech, the startup world, and also funding.
Okay, well, let's get started. Thank you everyone for joining. My name is Sonia. I am the managing director at Converge. And Converge is a software development company located in downtown Toronto. We also have a group of companies that are part of the Converge family, which is Menusano and Fieldigo. And today we have with us on our Instagram Live, Rosa Hoffman, who is the CEO and founder of a company called Medscures, which she's going to tell us all about. But she is in she's in the med tech space. And in addition to that, she's also recently a new mom. Well, not new, a mom again. And she also is in the automotive tech space, which I hope in 30 minutes we have sort of time to touch base on all these things. The focus of our talk today is mostly, we're going to talk a little bit about women in tech, startups, and fundraising. So welcome, Rosa.
Thank you for having me.
Yeah, it's great to have you. Why don't you tell us a little bit about yourself, Medscures, tell us a little bit about the company, what its goals are, what you're hoping to achieve.
Sure. So Medscures, what we've done is we've developed a prescription pill bottle that is sold to pharmacies on a subscription base. And what we do is we secure medication at a pharmacy level, which in hindsight, what it really means is if you have a highly addictive narcotic, you will not be able to access that narcotic unless it is programmed into the bottle by your doctor and pharmacist to release based on your prescription. So the goal is we're trying to really, first of all, is help with the abuse of medication. That's a big thing we're seeing. Standardize how medication is being provided to consumers and just keeping everyone safe. I mean, I guess that's the really big picture of what we're trying to do.
And what sort of made you come up with this concept?
A lot of it actually came from my personal experiences. I take medication every single day, and I had been going through like the weirdest thing, like just, we're busy. I'm on conference calls in the morning and I have to take my medication every morning at a specific time. So I ended up buying like all these smart bottles from the US, bringing them in, and they would always alert me, and they were the most annoying things on earth. They're like, beep, 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 beep. And I would just like, decline. Like, I'm too busy. I hate this. Don't want to do that. So what I did find was, it would end up confusing me more. It was like, did I press, accept because I took my pill, or did I actually forget to take it? Like, it didn't help me. So in that time, I started doing more research into the entire concept of creating a pill that only dispensed medication based on a requisition, and nothing really existed. And as I looked more into medical prescription drugs as a holistic view per se, I started to see how much of an issue medication was. And it's not just, narcotics. Narcotics, opioids are just one layer of medication that is abused on a daily basis. But there are a lot of medication that needs to be taken at a specific time that if someone in your household got a hold of, pardon me, would really affect and could potentially die from taking. So it started to really open up my eyes to seeing that medication in general, all medication, even vitamins, have to be secured, because if they get in the wrong hands, they can be very dangerous.
And can you tell us a little bit about, I know you and I sort of had a side conversation around like specifically opioids, and, can you tell us a little bit about what some of those statistics are around particularly like opioid pandemic and how people have become highly addicted to some of these narcotics, and how your technology is going to reduce that.
Sure. So, I mean, I can't, do not hold me accountable for these numbers as I don't have my documents in front of me.
You don't have to give us all the numbers.
Okay, I got it. But what I can tell you is 1 in 8 people that actually get a prescription for an opioid will end up abusing it. So that is already a huge statistic. In the US, I think they're doing about over 700 million prescriptions for opioids. In Canada, it's, I think, over 3 million. The numbers are insane if you think about how many prescription drugs are being, dispensed on a daily basis. And when you consider the fact that like 1 in 8 will abuse it, and 1 in 6 from those 8 will end up using harder drugs like heroin. So we are seeing a large amount of deaths. We're seeing a lot of fake opioids on the streets now because people want to get those hits. We are seeing a regulation with opioids where doctors are now not allowed to give it out as much. And that is why you've seen a really big increase in the fake opioids right now on the street, like fentanyl, things like that. But it's still an issue because it's still happening and we're still seeing it quite a bit.
Right. And, I know you've told us a little bit about what you do, and you don't have to get into all the details because I know you're still going through some patents and things, but how does your bottle sort of control that? If you can tell us a little bit more about that.
Yep. So our bottle is IoT. What makes our bottle unique is the fact that we are subscription based. We're 100% recyclable. The actual medication never actually touches our bottle. So we do have inserts. That's what makes us very, very unique, which we are going through the patent in the US, but we have it here in Canada. We are trying to be obviously green and not have a large amount of waste, but what happens is the pharmacy will end up getting the requisition. They will go into our back-end system. They'll program the bottle to release medication based on that requisition. And then the bottle is immediately connected. So when it comes to the opioid side, we've created our bottles with just pure Wi-Fi. And then we also have other bottles that are connected through Bluetooth. So if you as a consumer would like to have a little bit more awareness on how you're taking medication, if you're taking it properly, like a great example is if I went to the doctor today and they gave me medicine for, let's just say, an antibacterial. I had a cold, let's just say, and I didn't take the whole thing, but I feel fantastic. It will record all of that so that the next time I go to the doctor, they're going to know how to properly manage my expectations. So based on, my historical data today, I did well taking the medication for 5 days, and they really didn't need to prescribe me 10 days. So it's also about making medicine smarter for people. Not everybody is the same. And I'm not sure about you, but I know when I go to a doctor's, they give me the generic, everyone takes it for 12 days. Well, I don't think that's the case. Everybody is different. All of our bodies are different. Some heal quicker, some heal slower. So we're not all like one size fits all. So it's also going to help you really keep a record of that, share it with your doctor. And then the other element of it is I always think about when I get old and I die, I don't want to leave behind, unanswered questions for my children. So I am able to then pass on my application to them, and they can see my entire health records, what I've been taking, any health issues I may have had. So now they know what they need to be aware of down the road.
But when you were just explaining that, I also noticed a point where is like you're also helping with wastage. So, if I go to the doctor and they give me an opioid, I've taken opioids before, but I remember when I got I think they gave me 12, I only took 4, and the rest just ended up in my cupboard. So this also sort of helps make sure that, they're only giving people the right amount, and then they're also not wasting, right?
Correct. So if, for example, if you had one of our bottles, we are able to actually record and manage to see how you are actually taking your medication. So for example, you have your bottle of opioids. We record every time you dispense a medication. So if we would notice that you had not dispensed medication in, let's say, 30 or 60 days, the pharmacy can call you and say, by the way, we noticed that you're not taking the medication. Bring it back to the pharmacy so that we can properly dispense the medication. because that is what ends up happening is medication ends up in your cupboards and you self-diagnose and you take medication because you assume you think you know what you got to do, and they've expired. They're not good. They're not going to help you. And they're just hanging out there, or you throw them down the sink or in your toilet. And that is the worst thing to do.
Right, right. Yeah, I mean, the whole concept of what you're doing is super fascinating. But, I also want to touch base sort of like, being a woman in tech. I mean, not only are you in tech, you're also in med tech, and you have software, hardware component, which is really hard. So can you tell us a little bit about sort of like your journey in this startup world, and what are some of the things you've had to navigate through to sort of get you to where you are today?
Oh, sure. Yeah. So I've done some work with a few other startup companies who I would say were mainly male driven. And you learn a lot, I think, in that time. But I think as a female and having worked with female, the one thing I have to say is I find, and this could be biased, that we're more diligent. Like we are just very, all our T's must be crossed, all our I's must be dotted. And, even raising capital, as much as I could go out there and just mind my language, but I could BS and make up all these stories and make up numbers or do whatever I want to get that. I'm not. Like, I'm really particular in making sure that I am very much on the dot. Like, this is what I've done. I've done my market study. This is how much we can make. This is how much we have the opportunity to do. These are our test pilots. This is how we get there. So I find that as a female, and I've spoken to other females, I've been in Fierce Founders and in talking with like that cohort, like everyone has said the same thing. Like they feel the same way, where we do so much more due diligence, where I have worked with startups where male have been founders, male have been the guys who find the investment, but we never produce a product. We never go to market. There's nothing to show for it. And I can't do that. That was really hard for me. And it was one of those things why I think I waited a lot longer to get to the point where I was ready to start fundraising, because I knew I had a product. I knew I could go to market. I had done my due diligence. So there are moments where it is harder. I think it is a bit more challenging, but I also think that in the long term, I think we're going to see so much more females in startup and females running startup companies, just because we do a little bit more due diligence. No offense to any man out there. I'm sure there's tons of you who definitely do it as well. I'm just speaking out of my own experience. Right. And those were kind of my own challenges I found.
I mean, I agree with you 100%, because I talk to startups all the time. And one of the things that I know we did with our Menusano startup was we didn't get investment from the get-go. We bootstrapped. And when now we're at a point where we're sort of looking to bring in some capital to help us, because now it's become a global company and we need capital to help it grow. But now we have the advantage that we can go to an investor and say, hey, not only do we have this startup and this company, but we also have clients, and we have clients worldwide, and we have revenue. And I don't know if it's a woman thing. I mean, you kind of just touched base on it, if it's just doing our due diligence, but like, I don't think we are so super comfortable with going and looking for that investment without having something to show for it, right? And yeah, maybe that's just a trade.
Yeah, and maybe it's also because historically it's always been men running companies, right? There is that side of it too. So I think with women, we always have to like prove ourselves a little bit more. That's what we put on. I definitely feel like I live to that standard where I'm a little bit like, oh, I can't go to an investor and ask him to invest in a dream. But I think other people would feel comfortable with that, where I just don't. So I think it's a stigma we all have to work away from and just grow from it. But I think, like I said, there are plenty of women who are doing fantastic things out there that are in startup, that have really, grown successful companies. And yeah, I like that. I like seeing those stories.
Right. And I know that you are currently actively looking for investment in your company. I know that you're going to be probably very particular about it. And I know that you also did the Fierce Founder program. So can you walk us through just, for anyone who is listening who might be in a startup? I know there's a couple people who've joined that I know have startups or are looking to get into one. How do you sort of navigate through? I know a lot of times people ask me like, well, what do you do to find investors? Like, how do you even find an investor? So can you help us sort of navigate a little bit through that?
Sure. So being part of like Communitech, Fierce Founders, the Mars, Lot 42, or 41, sorry, or 42, I'm not sure. But incubators like those are so helpful. They help grow you as a team, as a company. They really structure you in knowing what to do next. I had been part of them with a previous company, but then I did Fierce Founders for Medscures. And I will admit, that helped me so much. It made me feel really confident in pitching. It helps you really structure on what you need to do next to get to the next level. A lot of these incubators have access to investors. They have access to venture capital money. They have grants. So it's all there. The Government of Canada also has on their website an option that you can go in, and it also provides grants that they have available to you. There's many websites that provide information on angel investors, on venture capital investments. So it's just, people think it's simple, but it's not. It is a lot of work. It's sometimes hours to fill out applications, especially with the government for grants. It is, you just got to go through it. You got to do what you need to do, and it's there. Pitch competitions, I think, are fantastic. They really expose you. They help you. And when you're in a pitch competition, there's, a crowd of people that are a lot of times investors. So whether or not you win, you make great connections. So a lot of it comes down to connections. Do your due diligence, make sure your numbers are correct, make sure you know the market, because when you sit down with an investor, it is not easy. They will tear it apart, rightfully so. They're investing in your company. So they're expecting their money to come back, sometimes double. So it's a lot of work.
You obviously have to prove that, not only do you have a good idea, but you also know what you're doing. Because I think a huge problem in tech that I've personally noticed, and I could be completely out to lunch, but it's my own personal opinion and I'm going to give it anyway. I noticed that a lot of people sort of go out with that dream and they pitch that dream and they have fancy pitch desks, but they raise money, but they never actually, like you mentioned, they never actually build a product. Or there's the ones that don't pitch, build a product, and kind of don't do anything with it. And I'm always so frustrated with people, because I'm like, okay, if you have investment, for God's sakes, build a product and start selling it. Don't spend the next 5 years just building. Get an MVP together, get it out there, prove your market, right? But then those who have actually put in their own money and built a product, and then the product is just standing there. And I'm like, okay, well, now the next phase is, your marketing. If you're not going to look for investment, at least get out there and get people to start using your product. But then, I feel like there's those two worlds that are sort of stuck in between, and people are not in a rush as much when they've had that investment, because they're just kind of like, okay, we have investment, we can sort of take our time. What is your opinion of that?
So what I've seen is people sell a dream and a concept that they think will become something. And when they get the investment, they realize, oops, can't actually do it. And I've seen that happen a lot. So then it's like they get to the funding part, they're trying to build this product that they've promised is going to be, the next Tesla, and it's not. And they can't ever achieve that. And so they just keep, pushing, and we're getting there. Timeline after timeline keeps passing. They keep raising because they're always raising on a dream. So I do see that happen often. And that's usually why. It's because what they've actually sold cannot be done. That's really it. And that, again, goes back to what I said earlier, which was I did not want to start raising until I knew that what I was dreaming could actually be done. And I put my own money into it. I built it. I got it done. I know it's possible. And so now I'm ready to do that, where a lot of people, it's the opposite. You got to remember, technology is technology. Some things are possible and some things are not. And just because you dream it and you think it, if you don't do the work into it, doesn't mean it's going to happen. And investors, and there are investors who don't know. They really just don't know. Like, I've sat down with investors for other companies who truly believed that something was going to happen that wasn't going to happen, even though I'll be honest, I knew it wasn't going to happen.
Right. So, just I know that you have the Medscures and you're in a startup, but you're also in the auto tech space. You're also a consultant for other technology companies. You're also not a new mom, but a mom again recently. How do you do it all? I mean, like,
I don't know.
I'm not gonna lie. I don't have kids, but I think compared to men, and this goes back to our topic about women in this industry, I think women just in general, we have a harder job than anyone, because not only do we have a full-time job, but we also have other full-time jobs at home, taking care of our kids. And I think a lot of that is sort of overlooked. But you're an entrepreneur, startup, how do you do it all?
I don't know. I actually don't know. I mean, I think I'm blessed because I do have like a really good family that helps and supports. My youngest is 3, but my older kids are 16 and 17. So they do help. And, I got good sisters, I got good family. So I do have that. So that's helpful. Without that, I really don't know how you do it. It's a lot of sacrifice. I mean, there's no you time. Like, that's the one thing I think I kind of understand. Like, when my husband goes on a golf game, it's like, how dare you? How dare you? How can you go on a golf game and I'm stuck here? Like, it's tough. We just,
you want to go golfing too?
No, but it's like you give it up because you have so many other things to do, and then you have the kids, and then you have to cook, and then you have to clean, and then you got to go back on your computer, and then you got to get back on your phone. And even if you don't have kids, it's just different, I think. And I don't know why that is. Again, I feel like it's something we've created for society has created on women in general. Like, we're just meant to be caretakers. We're meant to be that. So we've taken that on. But yeah, it's a lot of sacrifice. It's a lot of hard work. But if you surround yourself with the right people, I think it definitely does help. Automotive tech for me is kind of a walk in the park. I've been in auto for years, so I know it very well. And I will admit, I love it. When everything happened with COVID-19, we took a break with Medscures. We paused it only because our major clients are governments at this point in time. And since we don't have the government available to us, since they're so busy dealing with this pandemic, we've decided to just focus on putting all of that into patents and legal work and restructuring business plans, and just focus on the automotive side. So on the automotive side, what we're doing is we do artificial intelligence for properly aligning consumers with the right loans, but we focus mainly on subprime. So now that COVID's happened and a lot of people lost their jobs, a lot of people are unfortunately in this really big predicament where their credit is not at the best position as maybe once it was. A lot of people are going to be at that subprime level. So we're trying to make sure that everybody is at the proper lending possibility with the bank, that you're not getting ripped off and you're not getting 22% interest when in fact you should have gotten 11 or 10. So this is something we had been doing for a while at this point. And now that this has happened with COVID, it's just blowing up. The US market's opening up right now for us because of everything happening there too. So I've kind of shifted and I've gone back to really putting a lot of focus and emphasis on the auto side, only because I see that it is directly affecting this time and what's happening right now in the economy around the world. That is not to say that Medscures is not going to go. You'll see Medscures back up and running, but it's on a little pause waiting for the government to just come back up and at it, because we need government approvals and regulations in place to get these into pharmacies.
Right. Yeah. So like, you're really busy, but I know like sometimes I've I don't think I'm as busy as you are, maybe a little, but I don't have kids, so I have an advantage there. But, a lot of times I've had people, like if I'm out with a friend or something and, I'll look at my phone, like work doesn't stop for people who are running companies or entrepreneurs, right? You're always on. So getting an email at midnight or while you're on vacation, it doesn't, you're not going to pause it because you're on vacation, sort of, right?
You can't.
Right. So, but then I've always gotten very highly criticized for it. And I've had people in my life who like just bluntly like, well, why are you such a workaholic? And I've always been like very confused by that until I got to a point in my life where I'm like, you know what? I'm not a workaholic. I just do what you got to do. It's, but I think it's like, why do people automatically assume, like why do you automatically assume, hey, you're a workaholic just because you're trying to juggle all these different things, right? That's all actually it is. You're just juggling and you're just trying to also get your company up and running, and there's really no time to have off time, right?
I think it's passion, right? I think when you're passionate and you love what you're doing, it doesn't necessarily feel like work.
Yeah.
And there are people who are passionate about what they do, and there are people who aren't. And for them, it is a chore. For them, there's no desire. It's 9 to 5. I'm checking out at 5 o'clock. I'm done. Where people who are entrepreneurs, who are trying to make their dream become reality, I mean, you don't give that up. It's like having a child, right? You don't just give up on your child when it's 9 o'clock. You keep going and you keep pushing and you keep making it happen because those are your goals, your aspirations in life. So no, I don't think that's a bad thing at all.
Right. So I don't want to make this like super long, but just before we wrap up, I wanted to sort of ask you what I think, because you're highly in a male dominated industry, auto tech, med tech in general. What have been some of your biggest struggles in, not just being in that space, but also working with a lot of different men? Like, can you tell us? I mean, I don't know if you're comfortable, but
totally.
I know. Do you have some horror stories?
Oh yeah. I think I would say the most bothersome thing is that as a woman, if you are, strong and you're opinionated and you speak your mind, you tend to be called dramatic or aggressive or dominating.
So have you been called that?
Yes, I have. I have certainly been called that.
Okay, I figured.
And, but I have also clapped back where I've also said, if I was a male, you would never say that to me, ever.
Okay, so what was the reaction to that?
The reaction to that was, wow, I can't believe, no, I'm not like that. How could you say something like that? And I stood my ground, which was, if a man said to you that this is what we need to do in order to move this company to the next level, you would never say that he was being dominating. But if I ask you to do something in order to help us move the company to the next level, you say it's dominating because of my tone or because I'm asking you to do something. So those are real struggle points. I've worked with men that are fantastic, who are like super great. Like you would never know, like there is no differentiating factor. It's like, it's about ability. It's about what you can perform and what you can do. But then there are others who are like that. And that is hard. I've had my run-ins with people in the automotive industry in general, because as a female, it is a guy world for the most part, but I also find that industry has gone so much better. You just got to prove it. Usually if I sit down with a man and, the first few minutes we're like, oh, it's a girl. Ugh. But within like 5 minutes, no exaggeration, I know my stuff. I know how to talk. I get the language. I am, educated in that sense. I can totally perform whatever it is that I need to do. And I've proven it, and they're totally good. Everything's fine. So it's just, I feel like it's more work. If I was a man, it wouldn't be as much work. I could probably walk in there with a beer. Hey, buddy, let's have a drink. Like, they wouldn't care, right? I could just say whatever I want and they wouldn't care. And I'd probably suck, but they would probably be more open to doing something with me right away.
So are you saying
as a female, you got to work harder.
As a woman, you have to work extra hard?
Yes. Oh, I totally feel that way. Yeah, I would say that 100%. It's a lot harder. It's not easy. I'm not sure why that is, but it just is. And it actually, I do know why that is. It's because who we're selling to, who we're working with are always men. And those men are always working with other men. And those men are always working with other men. So when a female comes into the play, she's, bitchy, she's pushy, she's not like a guy. So that's what it is. So I think us as females have to break that culture and just have to start coming more up and supporting each other. It's also really important. As much as, men might be challenging, I enjoy working with men. They're nice, they're great. I have no issues for the most part, I have to say that. But females, we got to also learn to be kinder to each other. Like, be nice. If you're working in an environment where one woman got a promotion and you didn't, like, don't jump to conclusions. Maybe she's good at what she's doing. Right. It's okay if she's pretty. Maybe she does a good job. Like, we got to be nicer to each other too. So I think that's a big thing. Just be kinder.
What advice would you give to a woman who is currently, working in a company and wants to sort of get to the next level and feels stuck?
So I would say a few things. One, figure out what you want to do. That's really important. If you want to do something that will help that company grow, figure it out. And go sit down, talk to your supervisor, your manager, whomever it is you need to talk to, and tell them what your plans are in order to make that happen. And just prove it. Give them a little bit of time. Say, give me a month, give me 2 months. I'd like to prove that I can earn that position. I can earn to be there because this is what I'm passionate about. Just prove it. I mean, if you are passionate about it, and we just talked about it, passion is really important. When you have that passion, you'll do anything. Just prove it and you'll get there. Right.
Anything else? I mean, it's been sort of 30 minutes. I don't want to go over. Instagram cuts us off. I've learned that in my last one.
Yes. No, I think we
can talk about a million different things, but is there anything that you want to sort of add?
No, I you know what? I think, just stay passionate, keep focused on what you want to do. Don't let the outside influences get to you. Otherwise it will affect you. So just stay positive, keep moving forward. If you believe in it and you're passionate about it, do what you need to do. And I guess the one thing I would say, I'll end it with, the one thing for Medscures is that I don't have a medical background. So the one thing I made sure to do was to surround myself with everybody in the industry. So pharmacists, doctors, whoever could provide any insight. And so my board of directors is all pharmacists, doctors, the president of the the College of Pharmacies here in Ontario. Be willing to let go. Like, I would love to give someone the CEO position if they are qualified, if they're better than me. Like, that's, I think the goal in general is, it's not about ego for me. It's about taking this product, seeing it go to market, and making an actual difference in the world. So let go of ego and just, if you want to see your company grow, put the right people in place and watch it grow. Doesn't mean you're a failure if you're not the CEO. It doesn't mean any of that. It means you're actually way better off because you put the right people in play.
I agree with that 100%. I mean, at the end of the day, you as an individual can work and achieve so much, but you can't do it without having a great team behind you and the right people for the job. And I think that's 100%. Something like, I've always sort of had a team, but I didn't always have the right team. And when you sort of get into a place where you kind of have the right people in place, you start seeing things happen and things start flowing and it just starts happening. So I totally agree with you. Like, having a great, advisors and team behind you does actually make a big difference, because a lot of entrepreneurs have the reputation of being control freaks and sort of not being able to delegate and doing everything themselves, right?
100%. And team is important. And I will say that investors do care about the team. They want to know, like, if you're in an industry that you've never been in, who's behind you? Who's backing you up? How are you getting into that industry? So when you are raising capital, just be aware, team is very important.
And that's something that's also part of your deck, right? You put in like the team that you're working with, the consultants, or if you have a board,
advisors,
they are. And that's probably going to be very powerful to people who are going to invest in you, because they know that you are not only not only you believe in your product, but you have a knowledge base to back you up.
Exactly. Right. And I'm sorry, I said I was going to end it, but the last thing I would say, the one thing I struggled with the absolute most when fundraising and trying to raise capital was figuring out how to raise. So there are so many elements, like, do you raise based on equity shares? Do you raise based on, a convertible note? Just do your research, talk to your accountant, talk to a lawyer, and really figure out how you want to share. How you want to divvy up either shares, or if you want to do convertible notes, and how you want to raise, because that will make a difference. And I will say that out of everyone I've spoken to that had a startup, everyone has told me that the first time they raised, they got ripped off, which is okay too. Like, it's normal to get ripped off that first round. That's how you learn. But if you can know a little bit more going in, it can help.
Okay. This was great. I don't want to get cut off. Maybe we could set up another session, a different day, to get a little more in depth with a couple of these topics. But thank you for being on the IG Live.
Thanks for having me.
Yeah, of course. And for anyone who missed it, we are going to have it available on the Medscures Instagram account. We will give this to Rosa. We're also going to have it on the Converge Between Two Servers podcast. Yes, our name is Between Two Servers. We're nerdy. And we'll also have it in our podcast links and our LinkedIn and all of our different social media aspects. So you can view this again. You can contact myself or Rosa if you have any questions or comments, or if you want to contribute. If you're an investor and you want to invest in an amazing company, call her up. She's doing some great work in tech. And thank you so much, Rosa, for being on.
I'm just seeing the comments.
I know. I usually hate talking about women in tech. It's not a topic that, it's not that I'm not comfortable with it. It's not a topic for my own reasons.
Of course. No, for sure. Thank you, guys. Everyone who's watching, thanks so much for watching us too. It was really nice to share some info. Don't hesitate to reach out. Thank you.
And we'll keep an eye on you to see all the wonderful things that Medscure is doing.
Thank you.
Okay. Bye.
Have a good one. Bye.
Thank you for listening to Between Two Servers. You can find us over on Instagram, YouTube, and Facebook. The links are in the description of this podcast. Thanks again for taking the time to listen to Between Two Servers, and we'll catch you next time.